About 300 doctors from all across Oklahoma are meeting today in Tulsa to discuss better ways of tackling the state's opioid crisis. And here this morning is Dr. Kevin Taubman. He's the president of the Oklahoma State Medical Association. Dr. Taubman, thanks for being here.
My pleasure.
How big is this problem in Oklahoma? We read stories here on the news almost every day of some family that's affected by it, but as far as the medical community is concerned, how big of a problem is this?
It's a significant problem that we've been addressing for a while now. Oklahoma, as you all have covered very accurately, ranks in the top 10, most hit states in the entire nation. Tulsa County being one of the counties actually among our state that historically has had some of the most difficult times with these. And I think the doctors and other agencies that work with us have been trying to address this in as timely a fashion as they can.
Does it seem insurmountable to you when you get together as a group, 300 doctors talking about this? Is it just a huge mountain to scale? Or how do you take it piece by piece and say, we've got to attack this from any number of ways, because it's not just a matter of popping a pill. There are social aspects to this and family aspects to this, right? I mean, it's much bigger than just one person who gets addicted to pills.
I agree. It hits everyone. I would doubt that there are many people walking around our community who haven't been touched by this in one way or another. You do highlight an important point. There's a lot to cover, but I think based upon the way the everyday practicing physician is already trying to address this, the way our state commission on opioid use is beginning to address this, the way our other legislative bodies are trying to deal with it, I think as we delegate these responsibilities, we're going to gradually get a better control over it. I think if you look back compared to 3 years ago, where our prescription drug monitoring program that all physicians are mandated to use we were already seeing a slight decrease in the number of individuals who we would formerly classify as doc shoppers. And at the end of the day now, 3 years later, we've every year seen a steady decline in those numbers to the point now that OB&DD estimates maybe at best about 3% of all these diversion cases are really related to the doctor-patient relationship in its classic sense.
So you do have some hope that you can get on top of this?
I do. I think we have very capable individuals both in the medical profession and those affiliated with us who have a vested interest in this circumstance. And I have always thought, as a Tulsa native and an Oklahoma native, that when we put our minds to it and really rally people around an issue, no matter what money or lack of money there is, we can usually find a solution in time.
And that's a big issue too with the state budget, the budget cuts affecting the fight of this.
It is a big circumstance. The mental health issues alone, which are one of our vehicles by which we help offer treatment to these individuals, is going to be sharply affected by any budget cuts. I know that just here in the last few minutes we announced that the Senate is going to be passing on the combined bill to the governor, and I think the point I would make is, thank you for at least getting something passed, but at the end of the day, there are still going to be a large deficit of money that we need to fund not only what is going on today, but in the years to come. And so with their spring legislative session, I put a charge to them that they're going to have to work harder than they've ever worked before to solve that issue early on and not leave it to the circumstance that it was during this cycle.
Sure. All right, Dr. Kevin Topman, thank you very much, and best of luck to you because this affects so many families. We wish you the best.
Thank you, Scott. I appreciate it.
Lisa?